When a primary care physician makes a referral to an orthopedist or an ear, nose, and throat specialist, it's easier for the family to understand what that's about. The family is typically motivated to complete that referral. Also, the primary care physician is very familiar with that system, with that specialty system that treats children and provides that referral service. But it's very different for mental health. We typically are unfamiliar with the resources that are out there for mental health. They're in a complex environment. They may not all be in one place or delivered by one particular provider. And our patients can be very stigmatized and ambivalent and may not be ready to receive that referral. So for those reasons, it's a very different process. There are several things primary care physicians can do to prepare to be effective referrers for mental health services. One is at the practice system level. They can create a registry of children with certain mental health conditions or those who have positive screens and are awaiting further assessment for those positive screens. And then protocols to guide the office staff in how to proceed in relation to each of those in those categories of conditions. When to call them back in for appointments, what kind of tracking mechanisms to use, what kind of medication follow-up to do if a child is medicated, what kind of information to request from schools and from the mental health professionals to whom they provide. So all of those things, plus a directory of the services that are relevant to those children, are important prerequisites to making effective referrals. With those in place, physicians can then learn a special set of skills that help to prepare families for those referrals. And these are called common factors communication techniques. And we have training methods. Primary care physicians can readily acquire those skills, and they can help to overcome the ambivalence and sometimes even the opposition that families might experience in seeking some kind of mental health care. It's critical that every primary care physician have a plan in place to handle psychiatric emergencies. Most often that's something like suicidal thoughts and a plan. Sometimes it can be psychotic symptoms. It can be the threat of violence to others, just as examples. The emergency department is not necessarily the best place to send a young person who is experiencing that kind of psychiatric emergency. In virtually every community, there is an ideal route to go that typically involves a mental health specialist fielding that call. Then, for those situations that are not urgent, the physician can have in mind a variety of specialists who might include a social worker, a licensed professional counselor, a marriage and family therapist, a psychologist. A variety of folks might be available, and they might reside in a variety of settings, anywhere from a public mental health system to a private and independent practice. Many of them are actually present in schools, and that may be the ideal place to get services for a child. And in some communities, especially rural communities, it may be the only place to get services for a child. Those services can include observations of the child and a measurement of that child's functioning in the classroom, which can be very helpful to whoever is assessing the child. relationships with the mental health providers to whom a physician is going to refer are just critical in meeting the family's needs and also in closing that circle so that there is a feedback loop to the physician. Those relationships can be built in a variety of ways. In our network, we've had a lot of fun with mixers, and by that I mean social events that include both primary care physicians and the mental health and school professionals who provide services to that age group of child. So that's one way to do it. Some physicians are actually bringing mental health professionals into their primary care practice. And that is a wonderful model in which mental health and physical health services can be totally integrated. Whichever ways we use to build those relationships, ongoing communication is critical. Developing some methods of exchanging information between the primary care physician and the referring and the referral specialist so that both can be fully aware of the full complement of services that child is receiving, as well as monitor that child's progress.